Welcome back to the channel. Today we're going to talk about something a little more serious in that we're talking about one of the C's, lung cancer in particular. While cancer in general scares everyone when they hear the word, in effect, I think if it's found early enough and has the right medical approach, we can potentially treat people and come upon a reasonable rate of resolution. But despite that, the figures are daunting. Every year, 1.38 million people die from lung cancer. And it is by far the most common form of cancer worldwide. With that said, a lot of this could be attributed to cigarettes, but more recently, the bigger problem we worry about is pollution and the fact that living in the urban environments can actually expose you to a significant level of toxic inhaled components. Today, we're going to go over an interview with Dr. Amita Nene, a renowned pulmonologist at Bombay Hospital, who will talk a little bit about this and hopefully bring it to perspective. On this episode, I have the honor and pleasure of speaking to Dr. Amita Nene. And no, it's not another relative. They are part of the same sort of pseudo clan, but she is actually a board certified pulmonologist, ICU, as well as a lecturer and teacher for the Indian boards. She has over 50 publications in various peer-reviewed international and national journals. And in addition to that, has authored 12 chapters in the leading pulmonary textbooks. Fantastic doctor and fantastic person. Thank you so much for joining us today.
Thank you for having me over. I'm really happy to be here.
As you know, lung cancer is the number one reason people die from cancer, actually. And it happens in very high numbers worldwide as well as in India. And you know, they've done great strides towards trying to get people to quit smoking, to use tobacco, to do all of that. But what are you seeing now? Are you still seeing the cases? And before all of this, I'm sure, I don't know how many cases you're dealing with now, but you know, what were you seeing in your clinical practice with that?
Yeah, so basically the thing is that the lung cancer is definitely on a rise, which is very, very unfortunate. And what we are really seeing is that now lung cancer, the numbers are increasing in women.
Yes.
Because there's so much of women smoking which has started,
Yes.
which is extremely depressing, you know. And at the same time in India, in addition to smokers, malignant smokers cancer, we also have non-smokers cancer because of exposure to certain chemicals and certain gases, etc. So so India has huge numbers of lung cancer, and I'm just so happy that you brought this out because again, lung cancer is something that is preventable. You know,
I agree with that 100%. And you know, they say if you don't smoke by the age of 21, the likelihood of you taking it up after that is very low.
Very low, exactly.
Then let me ask you, I mean, I know in India that in the metro areas, we have very good ways of taking care of it, but what's your experience in the rural areas? How does this get detected? You know, in some ways, when I first came here, I thought a lot of what you see is a bit of a natural history study because it often presents late. What do you think would be the best thing? Screening? I mean, CAT scans in the periphery in high-risk patients who smoke more than 10 pack years and whatnot, maybe, but I'm not sure that people can afford it or can do it readily. Can they do sputum samples and compare them? Or do you find they often come in late and the only way to really turn this around in terms of mortality numbers is to prevent it?
Yeah, so again, very, very important and relevant question. The thing is that, you know, the incidence of lung cancer is in fact much more in rural places because rural India really smokes. They are really into BD and they are really into gutka and they are a lot into hookah.
So the world understands when you're talking about BD, you're talking about unfiltered raw tobacco cigarettes. And they're like the most potent, worst kind. Never tried it myself, walked around it, and believe me, it is pungent.
It is pungent, yeah. So the nicotine content is much more, and you know the amount of metals, etc. The crushes that are put also much more. So this BD is something which is extremely popular in rural India, and they do a lot of hookah, the actual hookah inhalation also. And at the same time, in rural India, a lot of places they actually burn waste, etc. And all the gases which come out are also carcinogenic. So the thing is that incidence of lung cancer in rural India is extremely high. Unfortunately, the symptoms of lung cancer could be very similar to TB, where you get this low grade fever and you get loss of appetite and you get loss of weight and then you're coughing. And very often, the doctor who does an x ray will feel that this is because of TB. And then you do one round of TB medicine, and then you do a second round of TB medicine, and precious time is lost in a malignancy, a cancer which was actually curable by surgery. By the time gets to a specialist, is now inoperable, and patients have very few months to live. So I kind of feel that what you are suggesting is the real way forward. We basically require good doctors in villages to be able to diagnose this, or they need access to good doctors. The lung cancer CT scan screening that you spoke about would be the best, because X-rays are not very useful, and even sputum for malignant cells does not have a good yield. So screening would be very, very useful, definitely.
I know it's a scary topic, and I'm here along with all of our team and all of the medical community to stand by your side. So I'd like to know from you guys, what precautions are you taking to prevent lung cancer? I think for the people who smoke, I will help you in any way I can to help you quit, because that's an obvious one where it's preventable. But for the rest of us who have to deal with pollution and other things, what are you doing in your lives to hopefully prevent this? I hope you enjoy this. And as always, if you like the channel, hit the like button. Make sure you share it with everyone you know. Subscribe so that you won't miss one single episode, and hit the bell icon to follow us and get updates. Thank you for joining us, and I hope you like the interview.